last month I turned 16. Now, being 16 is filled with taking on new responsibilities. This is also when you can start driving. I know, scary. So the day of my birthday, I went and I got my permit. And they asked me a bunch of questions, like when my birthday was and stuff like that. But they asked me one question that really took me off guard. They asked me if I wanted to be an organ donor. Now, this is quite a loaded question. I mean, it gives us a chance to think about what happens to us after we die. At first, I was pretty conflicted, but ultimately, I signed up to be an organ donor, which is recognized by a red heart on my driver's license. Now, after this, I decided to do a little research, and I found out some pretty interesting facts about organ donation. But what I didn't realize is that currently, in the United States, we are in an organ shortage crisis. In fact, we've been in one since the early 1980s. This is a chart of the number of transplants performed in 2021 versus the number of people waiting on the transplant list. I think it's pretty clear that some of these gaps are huge. As Andrew Flesher notes in his book, The Organ Shortage Crisis in America, nearly 120,000 people are in need of a healthy human organ in the United States. Our current system comprises of the United Network of Organ Sharing, or UNOS. They use base set criteria such as blood type, height, weight, and size of their organs to determine who receives an organ. 9 people get added to the transplant list every single minute. So let's take a look at how the waiting list works. When a new organ becomes available, UNOS's computer matching system generates a new specific list of potential recipients. Many people have the misconception that this waiting list is like a grocery store line, that each person is waiting for their turn to get an organ. But this waiting list is not that simple. All of the criteria that I have listed are carefully crafted into UNOS's decision to give up an organ to a patient. But despite this carefully crafted criteria, this system has failed to supply the demand of organs that is needed. And 17 people die each day waiting for an organ transplant. While we receive organs from deceased donors who sign up to donate their organs when they die, the United States organ donation system relies solely on altruistic donors, donors who donate the goodness out of their own hearts. But there is a problem with this, because many people don't want to donate their organs for basically a random person while they're alive. This is why we rely on organ donors who donate their organs with no incentive. But there is a right to question to whether or not this organ shortage is caused by exactly that reason. The reason that there is no incentive to donate organs. The American Institute for Economic Research grasps the idea that the main cause of this decades-long organ shortage is that paying organ donors is illegal. In 1984, the National Organ Transplantation Act, or NOTA, was passed by Congress to address the organ shortage and improve the organ matching process. This also established a law preventing organ donors from receiving valuable consideration or pay for their organs to be used in transplantation. Now, there are many reasons why it is objected that people should donate or compensate for organs. First, there is a fairness objection, stating that those who are less financially stable would not be able to donate organs, while those who are more financially stable would be able to buy an organ. Along with this comes an ethical viewpoint, stating that organ donation would no longer be a noble sacrifice, that it would just become a cash transaction. Now, while ethics are important to our moral obligations, the truth is, prohibiting payment of organ donation is saving no lives. But there is another effect to NOTA's no compensation law. An unseen form of human trafficking has developed: organ trafficking. Now, when I came across this, I was confused on how this could even happen. But clearly, NOTA's no compensation law is a huge cost. If we go back to my chart at the beginning of my talk, a majority of people waiting on the transplant list were waiting for a kidney. The World Health Organization estimates that 10,000 kidneys are traded on the black market worldwide annually, which is 1 kidney every single hour. But these black market transplants are crazy because they happen in reputable hospitals in our cities. But makeshift operating rooms in people's homes have also become a location. Desperation plays a key role in trafficking because organ donors and people who organize these black markets profit off of those who have no other choice than to receive transplantations and have the means of paying for one. These desperate patients engage in something called transplant tourism. This is a trip that can take you anywhere in the world, ranging from Southeast Asia to the Middle East, or anywhere filled with impoverished people. Now, while we look at the negative implications of the organ shortage crisis, let's take a look at how altruistic donors are making a difference in our world. Altruistic donors are how donor chains begin. Donor chains are when an altruistic donor, out of the goodness of their heart, tries to donate a kidney to a recipient in a kidney donor chain. That does not match them. But then that altruistic donor can donate that kidney to another recipient in the chain, creating an endless recipient to donor pairings. In fact, the University of Alabama, Birmingham holds the longest kidney donor chain, with 101 people receiving and donating a kidney. While these kidney donor chains shine a light on the goodness of our world, they won't solve this organ shortage crisis. While we, as individuals, can't do much to solve this problem, there have been a few solutions proposed through the years. First, as I talked about earlier, compensating donors for their donations would be a vital step in this process. While there are moral obligations, a regulated private system of paid organ donors should be installed. Along with this, we should implement programs to educate the public and healthcare workers. I mean, I'm gonna be honest, I knew a minuscule amount about the organ donor process and how severely lacking this country is of organ donors. Think about it this way. Your friends, family, or loved ones may need an organ transplant someday, and they may not be able to receive one because of this organ shortage. Which leads me to my final and specifically my solution for all of you. If you haven't already, sign up to become an organ donor. Studies show that 90% of people support organ donation, while only 60% of people are actually signed up to be an organ donor. Now, this decision takes a lot of guts. I mean, literally. But if we take the necessary steps to implement a gap between the bridge of need and supply of organs, we may be able to solve this decades-long organ shortage crisis. So if you're turning 16 like me and you're getting your driver's license, make that decision. Donate your organs. And if you're an adult, just do it when you renew your license. But while you're doing that, think about the lives that you will be saving. Thank you.